Finally today, a remarkable science story. An extraordinary scientist who pushed the limits of technology and social norms to extend his life has died. After a motor neuron disease diagnosis, Dr. Peter Scott Morgan developed a lifelike avatar so he could express emotion. He had a voice box fitted with his own recorded speech, and he used eye tracking to operate computers. He was dubbed the world's first cyborg, as Stephanie Smale reports.
Hello, I am the future.
This is Dr. Peter Scott Morgan's avatar, known as Peter 2.0, introducing himself to the world.
For decades to come, I will keep Peter's personality alive, and for all the time, I will continue to evolve, dying as a human, living as a cyborg.
In 2017, the robotics expert was diagnosed with motor neuron disease and told he had 2 years to live. That was the start of his mission to use robotics to extend his life.
I'm delighted to be here with you talking about how technology offers hope to people everywhere.
He worked with experts to create a synthetic version of his voice, which he uses in this interview.
I see this new challenge not as a setback, but as a unique opportunity to do breakthrough research into how technology can change what it means to be human.
Dr. Scott Morgan worked with a more advanced version of late scientist Stephen Hawking's eye-tracking technology to help him express himself as the rest of his body stopped moving.
My brain is racing away, frantically wanting to communicate with the outside world, to write emails, to work the TV remote, to chip into conversations. But I'm only able to move my eyes. It's like being in my own private universe, only able to tap out Morse code to the rest of you.
And he explained, as well as major physical interventions to keep him alive, he was using artificial intelligence to keep interacting with others, including smiling.
Cyborg is simply a fancy word for part human, part machine. In my case, what's never been done before is that the most important machine parts of me will be AI, not mechanics. And that all potentially gets a bit weird. Not least because I'm planning to use more and more AI to work with me on everything. Everything from speaking to controlling things to moving about.
For him, it was always about how you can get the best of the human and the artificial intelligence.
John Whittle is the director of Data 61, the CSIRO's digital research and development arm. He describes Dr. Scott Morgan's story as inspiring and explains how the artificial intelligence system he used and helped to develop worked.
It would actually learn the kind of interactions that he has had in the past, and then based on patterns that it had identified about the kind of things that he would say, if somebody was asking him a question, it would give him a set of canned responses. Now, he still chose the response, so it wasn't taking over the conversation, but he could just move his eyes to pick whole sentences or whole paragraphs at a time rather than one word at a time.
If his physical being has passed away, does that mean his artificial intelligence presence ends too? What happens now?
In a sense, there is remnants of him that will live on. So, part of what he did to prepare for that technology was to record himself speaking various texts, I think like thousands of texts. So, in a sense, you can say that is going to live on, and somebody could potentially still interact with his synthetic voice, even though he's no longer around. It's still only an AI system, though. I think we have to be clear on that. So we're not kind of breaking the rules of life and death here. It's mimicry, I think, is the best way to describe it.
That's John Whittle there from the CSIRO's Digital Research and Development Arm, ending that report from Stephanie Smale about the life of Dr. Peter Scott Morgan.